Hello everyone, I'm Dr. Ezenwosu Lilian, resident doctor in the Department of Community Medicine UNTH. You're welcome to UNTH Health Education Series, and I'm here to talk about peptic ulcer disease. Peptic ulcer disease is something that is common in Nigeria, and in our locality it's called Onya Afo. What is peptic ulcer disease? Peptic ulcer disease are open sores that are found in the lining of the stomach and the upper part of the small intestines. Having said this, it means there are two types of peptic ulcer: the gastric ulcer, which occurs at the stomach, and the duodenal ulcer, which occurs at the upper parts of the small intestine. About 10% of people have suffered from peptic ulcer disease, which tells you that it's common. Peptic ulcer disease is caused by two major factors. One is Helicobacter pylori, which is a bacteria that is found in the intestinal lining of the mucosal layer of the stomach. The other is constant or frequent usage of pain relievers. The most common pain reliever that causes this ulcer is non-steroidal anti-inflammatory drugs. Examples are aspirin, ibuprofen, and naproxen. These drugs can be purchased from the chemist or pharmacist, and sometimes we take it without even knowing the effects of these drugs. I need to explain how the peptic ulcer disease develops. Normally in the body, the mucosal layer protects the stomach and the intestine from the gastric acids. But when there is excess secretion of the gastric acid, or there is damage of the mucosal layer that protects the stomach and the intestinal layer, it leads to peptic ulcer disease. Even though there are two major causes of peptic ulcer, there are also other factors that can predispose someone to having peptic ulcer disease. And these factors can aggravate peptic ulcer in a person that already has peptic ulcer. What are these factors? You have smoking, you have alcohol, you have stress, exposure to excessive stress. You have taking of spicy food. These are the factors that can aggravate ulcer in someone that is prone to having a peptic ulcer disease. So what are the symptoms of peptic ulcer disease? The symptoms of peptic ulcer disease can range from mild to severe symptoms. A patient with peptic ulcer can just present with chest pain, a burning sensation at the middle of the chest, easy fullness of the stomach, belching, or poor appetite. These are the minor symptoms. Also, this patient can also come down with severe symptoms such as vomiting of blood and stooling of blood. If these symptoms are not taken care of, they can lead to complications. And these complications can be intestinal bleeding, perforation of the intestinal organs, obstruction of the intestines, and gastric ulcer. So that means that we need to act in order to prevent peptic ulcer and to detect and treat it early. So how do we prevent peptic ulcer? So it just can be prevented by taking note of all these preventions I've said earlier. You stop smoking, stop taking alcohol. Before you take a pain reliever, verify from your doctor the type of pain reliever to take. And then stress. You need to take rest in order to prevent stress. You need to wash your hands frequently in order to prevent Helicobacter pylori infections. How do we treat peptic ulcer disease? Most times the treatment is based on the symptoms. And therefore, if you have the symptoms I've mentioned earlier, notify your doctor or the nearest health facility. In conclusion, peptic ulcer is treatable and is preventable. Thank you. If you have any clarification from what I've said so far, there's a number on the screen. Call us or visit any nearest health facility for further management. I am Dr. Ezenwosu Lilian.